Hi, I'm Leslie Thompson, and welcome to the Plastic Surgery Channel. We're talking today about body contouring after bariatric surgery, and I'm joined by Dr. Mike Dixon, a board-certified plastic surgeon with a practice in Amarillo, Texas. Dr. Dixon, thank you very much for joining us.
Thanks for having me today, Leslie. It's quite a pleasure to be here.
Well, I know that you have seen a number of patients who have had some sort of plastic surgery after weight loss surgery, and I'm wondering, first, what type of body contouring procedures are the most common that people look for?
The most common procedures that we perform as a post-bariatric procedure would be a procedure to address the trunk of the patient, procedures to address the breast, usually of female patients, but often of male patients as well, procedures to address their thighs, both the inside and outside of their thighs, and often their arms. Occasionally we have patients that we address facial issues as well.
Well, let's talk specifically about the stomach area, because I think for most people that is the most obvious problem area and the one that they want most quickly resolved. What is the difference with an abdominoplasty or a tummy tuck in a post-bariatric patient who's lost a lot of weight versus maybe somebody who wants one after a pregnancy?
The main difference in those two procedures is the areas of laxity that need to be addressed. In a post-bariatric patient, they usually don't just lose weight only in the front. They lose weight over their entire body, which gives them some laxity in the back as well as the front. So often those patients are addressed with a circumferential or all the way around the body lift, or often called a belt lipectomy. If you can imagine the distribution of a belt, a lipectomy would be to take out fat. So taking fat out or skin out around the body circumferentially is much more common in the post-bariatric patient than it is in someone who may have had a pregnancy or may have lost a minimal amount of weight and want just the abdomen recontoured.
Well, my guess is then it's a much more involved procedure. You're going 360 degrees. So in terms of the surgical time and the recovery time, what can patients expect?
You can definitely expect a longer recovery and a longer surgical time. I think that the belt lipectomy in my hands is usually done somewhere between 3.5 to 4 hours. For an abdominoplasty, we're only addressing the front. That's going to be a much shorter time period for recovery and a shorter time period for surgery. As far as recovery goes, it's very patient dependent. But I find that most of my post-bariatric patients are back to most of their activities within 3 to 4 weeks. To go back to full activity, high impact aerobics, horseback riding, etc., usually going to take about 6 weeks.
So with the procedure itself, how does that actually work? I mean, is the skin actually physically removed, and what does the postoperative scarring look like?
I often kid with my patients that the scar looks like they have been the assistant for a very poor magician who has done the saw the woman in half trick, because you will have a scar all the way around your body. These procedures are performed different ways by different surgeons, but the way I do this procedure is to start on the back first. So the patient goes to sleep and then is turned onto their stomach in the operating room. I find that the laxity of the back is not high to low, it's the buttocks now droop. So we work on taking laxity out from below and moving that area up. After we have performed that part of the surgery, we turn the patient over, and in the front we work on pulling the front down. So if you sort of think of it like a seesaw with a pivot point that we still elevate, that the front comes down and the back comes up.
Interesting. Well, having spoken with a number of bariatric patients, they're often just very eager to have their plastics done after losing a lot of weight. What kind of time frame should people look at after bariatric surgery, whether they had a lap band or a gastric bypass, they've lost 80 pounds, 100, 150 pounds, before they really consider having this type of procedure?
And they've gone through a lot, and they're looking for that final reward after they've gone through that. Again, in talking to my patients that come to me early for that, I tell them sort of like the 14-year-old boy who wants a sports car. He wants it, but he's not quite ready for it. I find that these patients need to start thinking about body contouring at the earliest 1 year. More often, this needs to be 18 months, even longer. But the key is not a chronological time. The key is, when has the patient met a plateaued weight that they maintain and that they're comfortable with? Because as you well know, there will be weight loss and a plateau, and weight loss and a plateau. And we want this patient to be where they're comfortable with that weight and not anticipating losing a lot more weight. Otherwise, there'll be additional laxity and they'll need the procedure again. We should do these once and do them well rather than continue to try to trim and trim and trim.
Well, Dr. Dixon, thank you very much for your insights today.
Thank you for having me. It was certainly a pleasure.
And thank you for joining us today. I'm Leslie Thompson for the Plastic Surgery Channel.